We're joined on the line by Dr. Marty Makary. He's a health policy advisor to Presidents Trump and Obama, editor-in-chief of MedPage Today, surgeon and professor of public health policy at Johns Hopkins, and a patient right advocate. He is also the author of the book, The Price We Pay, offering a coherent vision of how free market solutions can restore quality, affordability, and humanity to a broken system. Dr. Makary, thanks so much for joining the show.
Great to be with you, Ben.
So let's start with, obviously, the news that's on everybody's mind, this massive lockdown that's happening in cities across the United States. Unprecedented, really, in American history. I mean, outside of wartime, but maybe even inside wartime, it's pretty astonishing. Businesses across the land shuttering. How effective are these measures going to be at containing the spread of the virus? And the bigger question for me, and the one I've been asking myself, is, let's say that we lock down for 15 days or even a month. At the end of that, when everybody emerges from their houses, aren't we just going to get an outbreak of this thing brand new?
Well, usually there is a community benefit or sort of a community immunity. And actually in China, I was talking to a doctor there last night, and they are beyond the worst point. They've peaked, and now people are starting to come out, and the cases presenting to the hospital are way down. The virus just kind of poops out after a couple months, and we've seen this consistently. Spanish flu of 1918 that killed 25 million people, that lasted 3 months. September till January. MERS, SARS, these global pandemics with novel strains tend to be about 3 months.
So with that said, the president suggested yesterday that by July or August, things may be getting back to normal. Where would you put the deadline for when you think things start to at least move toward normalcy again?
I really think closer to June, we could probably get back to normal and be in the clear. I mean, they're probably being a little conservative by saying, hey, just get ready until July or possibly August. The more we can do to reduce the transmission now it's kind of in the rapid spread phase, the lower the peak will be. And that's what they call flattening the curve. It sort of spreads out and prolongs the pandemic. But we avoid that mass rush, or we lower it, because that is our real threat right now. The good news about this virus is that it is hard for it to really hurt a young, healthy person. It can, but it's hard. And it will be over by sometime in the summer. That's the good news. The downside is a lot of folks are sort of coronavirus deniers, if you will. And a recent study found that 40% of Americans don't even think it's going to be that bad, or they think the worst is behind us. I'm concerned about those folks because even though we might look around and say, hey, I'm outside, I'm in the park, we're having fun, we're going for runs, none of my friends are sick, what's the big deal? The reality is we are community silent transmitters, sometimes symptomatic transmitters, and it's our most vulnerable that take a heavy, heavy hit. And, China has not been transparent with their data at all. Iran has not been transparent, no surprise there, but Italy has been totally transparent. And if we look at the average number of deaths in one day, each day, that is a preview of what we can expect in the United States. And those numbers do not look very good for us.
So one of the questions that I've been asking, folks have been asking about the coronavirus here is what happens in a second wave. So the Spanish flu had 3 waves. The second wave of the Spanish flu is actually the most deadly. Presumably a vaccine is not going to be ready in time for fall, which is when presumably the summer weather would sort of alleviate, and you might see an uptick again in coronavirus, which means that really the only solution at that point is we better have expanded the number of ICU beds available. Do you foresee that there would be a second wave of the virus and that this becomes sort of a normal part of our flu season every year?
A lot of viruses with novel strains do not have a high reinfection rate or second wave. I think in China, when I talked to the folks there this week, they are very nervous about a second wave. But so far, no indication that it's really got that second wave. I am worried about our capacity. Look, I'm worried about our nurses and first responders and respiratory therapists and docs. Look, healthcare workers are the highest risk individuals. We only have 100,000 beds. ICU beds in the U.S. I mean, projections are showing 200,000 patients could be coming in for critical care to 2 million patients. I think we got to look at the facts. I mean, this is about data and facts. This is not fantasy football. And you and I know that we live in an era where people like to blurt their opinions without any real information. Right now, we need to look at what's happening in data in Italy. 350 deaths on Saturday, just on that one day. Extrapolated to the U.S., that is, take that number, adjust it for the U.S. population and age, That's the equivalent of 2,000 deaths in one day in the U.S., 3 to 6 weeks before our peak. Now, I hope we don't get there. Some say we might be worse because we didn't do an early quarantine like they did. Somewhere in that ballpark, we could see a massive influx, and I think that's what the data are telling us to do.
We're speaking with Dr. Marty Makary. His book is called The Price We Pay. And we'll get to that book in just one second, Dr. Makary. I want to ask about the sort of differential public policy positions that have been taken by various governments. So we saw the UK take a very different position, and then now they've switched that position. Their early position was, we'll quarantine basically everybody who is over the age of 70. Everybody else go about your business, because the economic impact, obviously, of shutting down the entire world economy are going to be extraordinarily dire. They're basically forcing trillion-dollar loan payoffs and people signing checks from the government level. The UK has now reversed itself. Denmark has not. Denmark is pursuing a policy of herd immunity for people under the age of 65, and then basically everybody over 65 should go into hiding. Why is Denmark wrong? Why is the policy the United States is pursuing, which seems to be, at least on a local and state level, a giant lockdown? Why do you think the U.S.'s policy is going to be more effective than that of Denmark?
Well, obviously people are acting with the understanding that I'd rather look back and say I was massively overprepared and maybe even overreacted than get on the wrong side of this issue. Again, this is not a horse race, or this is not, the World Series where if somebody loses, everyone will be fine. This could have, being wrong on this could have mass fatalities. I think if you look at what we're learning, Singapore did some very aggressive maneuvers early on to try to test and trace. Now they are looking at another sort of, it's now out. They reported a lot of new cases this past weekend. So, containment and testing is good early on, but at a certain point, the idea that it is somehow contained is an idea we need to abandon, and everybody needs to take extreme precautions. I think I couldn't agree with you more, Ben. And you know what I'm concerned about? We're spending money like we have an unlimited supply. I mean, we're just spending money like crazy, right? And I'm not even sure we understand exactly what we're buying with that money and how much more can we spend. Let's look at what we actually need. Respirators, we need more awareness. We have got to keep essential workers on the job. That is, and let me define it very clearly, healthcare workers, pharmacy, supply chain, food service workers, delivery, even restaurants that deliver. And I would add to that payroll, financial services, and the liquidity in the credit markets. If that stuff goes, if people stop getting their payroll checks, I mean, that could be much worse. How are they going to buy food? We just don't want, and I feel strongly about this, we don't want high-risk people running around active in society right now. Older folks, people over 70, maybe even people over 60, people who are immunosuppressed, lung disease, organ transplant, on chemotherapy. Those are very, very vulnerable folks. We don't want them at the workplace.
We're speaking with Dr. Marty Makary, health policy advisors to both Presidents Trump and Obama, and the editor-in-chief of MedPage Today. So in your book, The Price We Pay, you talk about how free market solutions can be brought to bear to our broken medical system. There's obviously been a lot of talk about what the role of government is in the medical system during a pandemic. You mentioned the shortage of ICU beds, only about 100,000 ICU beds available across the country. Would that be any better if we were talking about a nationalized healthcare system? Obviously, Italy does have a single-payer system, and they were completely overwhelmed by the epidemic. The notion that this could have all been solved preemptively by government simply paying to keep ICU beds empty, it seems like a very odd takeaway from this situation. But what were the benefits and the drawbacks of America's healthcare system as this pandemic broke out?
Well, we are seeing an increase in capacity that we've never seen before. And I worry that if we didn't have our strong private healthcare system, we wouldn't have that fluidity to expand rapidly. Look, we saw during 9/11, hospitals made 50% of their beds available. That is, they quickly mobilized. And that's what we're seeing right now. The problem is there's only so many respirators and you can't build them quick enough. So we need to reduce the transmission rate so we don't get that massive surge. As you may know, and as I've told presidents from both parties, I have serious issues with nationalized health care. In the short term, it is very appealing. You cut out some of the middlemen that are price gouging, right? But ultimately, over time, governments invariably cannot resist the urge to make across-the-board cuts. And 10 or 20 years into it, you are left with a massively dilapidated healthcare system. I have met with candidates, and when they tell me, let's talk healthcare ideas, I say, okay, tell me your goals. And they say, expand coverage and lower costs. And I say, okay, I love that. We all love that. I'm sure there's some diabolical person out there that doesn't want that, but those are wonderful ideas. We are currently spending 48% of all federal spending on healthcare, 48%, nearly half. Think about that when you file your taxes. We've done that study at Johns Hopkins. It's on restoringmedicine.org. I published it in USA Today. Almost half of federal spending today goes to healthcare in its many hidden forms. I tell the candidates, what are you proposing we increase that to? 75, 90, 200%? Do we cancel all other national priorities? Because it still won't get you there and fund the system. How about we cut the waste? How about we get price transparency? How about we create efficient markets? Because the fundamental problem in healthcare is we have non-competitive markets. The temptation for anyone who's looking on is to say, well, let's create rules in those markets. The problem is they are non-competitive. And this executive order I worked with, I had the pleasure of working with the White House, will create competitive markets if it is not overturned by the Hospital Association lawsuit.
So back to the coronavirus topic for just a second. So if you're talking to the American people right now, which you obviously are, and you're telling them what they can expect over the next few weeks, do you think that these restrictions, the heavy restrictions that we're seeing in San Francisco, in Los Angeles, in New York, that these do in fact last all the way until June, or do you think that this is sort of a 6-week thing and then it sort of starts to let up? One of the problems I've had with the White House response and maybe the medical industry's response to all of this is without people being told what kind of timeline to expect here, it's very difficult to expect people to stay in their homes indefinitely. When we say sort of until further notice, everybody who has 3 kids is thinking to themselves, are you insane? Until further, I'm going to stay in my house with my 3 kids until further notice. This could be a year. Like what do we, you said 3 months until the actual let up is what you think is going to happen. But how much until people actually are getting back to work, even sort of part-time, until people start eating at restaurants, including with social distancing, for example?
I honestly think it'll be late May or June that we sort of are able to get out there. But I would point out, go outside, be on your property, go to parks, walk. Sunlight is very therapeutic, and it also, it's hard for that virus to live out there in the sun. So it is good to be out there. I do think people are going to get stir crazy, but hey, this is a once in a generation pandemic, the worst since polio, far worse. This is Hurricane Katrina about to hit our shores, except over 100 times more deadly. We have a lead up period. I've been encouraging people to go to the grocery store and make sure those at risk have enough food for 3 months. We don't want hoarding, and we don't want, people clearing things out and being selfish. It'd be unethical for anyone to have more than 3 months of food, but people should get ready. And what we're seeing in other cities is that they're having folks go out one every 3 days. One out of every 3 days, somebody can leave the home to go to groceries or for a family emergency. I don't know if the government's going to impose that in the United States, but I do think the private sector is already getting smart and basically executing a lot of these best practices.
Well, Dr. Marty Makary, health policy advisor to Presidents Trump and Obama, editor-in-chief of MedPage, today surgeon and professor of public health policy at Johns Hopkins. His book is The Price We Pay. Go check it out right now, all about how to fix America's broken healthcare system. Dr. Makary, really appreciate your time, and thanks for all the information.
Good to be with you, Ben.
I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.